and welcome. My name is Carol Antequera, a PA in the Division of Gastroenterology at the University of Miami in South Florida. In my last video, I reviewed the different types of tests and modalities available for colorectal cancer screening. In this video, I will walk you through some considerations for helping your patients choose the best option for them. Now that we've enhanced our understanding of some of these tests, indications, and guidelines, we can better position ourselves to make the best recommendations for our patients. I do want to take a moment to explain the role of the FDA in colon cancer screening. The FDA provides approval for tests and other products based on their safety and efficacy data, and they also consider standardization of these tests. Guideline writers have a different responsibility. They evaluate the potential for benefits and harms of varying methodologies and make recommendations for how to integrate them into practice. The tests we discussed in the last video are guideline recommended with varying frequency depending on their sensitivity and specificity. The newest blood-based test does not appear in many of the guidelines that have not been updated in the last year or so. When discussing options for colorectal cancer screening with our patients, we also need to take into account their family history. And for those patients at an elevated risk due to family history of colorectal cancer or adenomatous polyps, those patients should go for a colonoscopy. Patients should also understand that the stool-based tests are effective, but they do need to adhere to the instructions and recommendations for frequency. It's important also to remind our patients that stool-based tests do not require any form of bowel preparation, anesthesia, or transportation to and from the exam, and can be done in the comfort of their own home. However, it is also important to inform them, again, that if any test is positive, they do still need to proceed with a colonoscopy for direct visualization and further evaluation. These decisions should be made with your patients and individualized based on their needs. We as PAs are perfectly positioned to walk our patients through all of the options for screening methods. So, we already know that colonoscopy and sigmoidoscopy are direct visualization studies, and these tests can detect precancerous lesions and can also be therapeutic at the same time, as polyps can be removed during the same study. They also do need to know, though, that for these tests, patients do need to do a bowel prep, there may be anesthesia or sedation involved, and they will also need to have transportation to and from the exam. It is also important to note that the stool-based multi-targeted DNA study also has the ability to detect precancerous lesions in the colon, making this a very good non-invasive option for patients. As PAs, we have the responsibility for making sure our patients get the screening that they need, but that doesn't mean that we don't always have significant barriers standing in our way. In the next video, I'll be talking about barriers to screening and how we can overcome them.